Okay. Louisa, volontaria, put it back here. Pardon? Yeah, okay.
Hello?
Louis, he's waiting for her. Let the woman go. Release the woman. Oh, finish with the girl. If Yvonne. Yes. No, no, you're the one who's starting. We're waiting for you. Yes. Yes. The introduction has already been given. You're starting. Women and TV. No, no, I didn't get it. The announcement was made just now. Where's the lady? Huh? Jenny. 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 You have to come and moderate. Yeah. Yeah, no, here. Moderators introduce her again. That introduce the session. Yeah, yeah. This Yvonne, what the session is about, that's what she wants.
HIV positive, they have got TB. We've seen a lot. So much has been done. We
started with our session here at the Women's Networking Zone. The session is entitled Women and TB, HIV. So we have here on the panel joining us Yvonne and Chaka from the Princess of Africa Foundation.
If happens now, it's going to be 100 steps backward. So we don't need to be calling our sisters and our brothers, they and us. We are all together in this. If you are not infected, you are affected one way or the other. So we need to be working together and making sure that we help our women. Ooh, am I dying?
You're okay, you're okay.
Make sure that, we help our women because if you give a woman $20 or even $10, so much is going to be done from that. So women do so much, yet they are the ones who are disenfranchised and ostracized in many ways. In other villages, women cannot even tell their mothers-in-law that they are pregnant or that they are HIV positive because they'll be chucked away. Your husband dies in other countries, and then your brother-in-law has to marry you. You can't say no. It's obscene. It's madness. It's people like you and me who have to start talking about this. We can't not do it. This is the time for us to talk about it, walk the talk, and make sure that it's not a vicious cycle. The young children who are there, if we don't fix this place now for them, it's going to be a mess. And we are going to be judged by the next generation. So I am happy to be here today with great women like Carol and Louisa, because it's not the end of the world, We as women, the world, we're going to rearrange. We have to, aren't we? Yes, because everywhere you go, in everything you see, everything has element of femininity. Women are an ocean, nurturing and strong. Everywhere you go, you'll find the answer to the song, What is a Woman?
Thank you very much, Yvonne, and thank you for your usual support. So people usually say that there's more stigma around TB than there is around HIV. And also people say that the HIV activists are more organized than the TB activists. I think when you look at even the treatment for TB and HIV, when you're in treatment for HIV, it's for life. For TB, it's 6 months at the most. And it's over. It's really up to us as people who have had TB or representatives or activists to support people who have had TB to come out. I always tell people about my HIV status. I've been on treatment for 10 years. And when I give speaking engagements, I tell people that by me telling you that I'm HIV positive, I have taken the power away from you to stigmatize me. I don't allow anyone to stigmatize me. When I found out my HIV status, I had fully blown AIDS. You know, the S in AIDS, I had everything. The syndrome, I had Kaposi sarcoma, I had TB, I had everything. I have struggled to move from the AIDS stage to the HIV, just being HIV positive. And I get angry if you tell me I have AIDS. So that is what we should be doing for TB. As Yvonne said, women, in most cases, sometimes you find it was actually even just brought to you. I know women who have never gone out to drink. They always go to church. The only man they know is their husband, but they have HIV. And those are the kind of women who sit back home and hide. So it's people like us who should go out there and help the women come out. If we don't come out, talk about it, TB will always be in the corner. So we need to talk about it. TB is killing us people living with HIV. It's our main killer. 1 in 5 people living with HIV and AIDS die with TB. Why aren't we panicking? I really don't understand. The investment that's been put in us, like I said in the beginning, I've been on treatment for 7 years. And I'm okay. I'm living a positive and productive life. I could have TB next week and I would die within a week. So all that investment is gone. So please, let's talk more about TB. Keeping quiet will not keep the TB away from killing us. Now we even have the drug-resistant TBs that are, even more lethal. So I thought maybe I should pass on to Louisa for her to share, I think, her experiences with TB and HIV. Louisa.
Thank you, Carol. As you have already heard, I'm Louisa from Zambia. I'm a person who has been living with HIV for the past 13 years, and I've been on treatment for the past 13 years. I suffered from TB, and at that time it was not easy. I think there was a lot of stigma attached to TB, but I managed to pull through. I think as Carol has put it, as a woman, I think we really need to be strong, because if you people in a community stigmatize you, there are people who can die from stigmatization. But I think I didn't have that, because I was open from the beginning. When I just discovered that I had TB and I was diagnosed HIV positive, I think the part of stigmatization was not there, because I was very open, and I had the support from my family, from friends, and from that, I think it made me strong to be what I am here. I've lived with it, and no one can stigmatize me. I go out, I talk about it, I share it with my children, and I've lived to this time. I'm now about 50, but I'm able to do certain things which even normal people cannot even do it. I'm a strong person, I'm a grandmother, I'm so happy. So I think this can only be done if us women can unite ourselves and help others who are there, people who still stigmatize themselves. I think we are the only people who can come out and help them. Without us, I think they'll die from stigmatization. So I urge us women, let's be strong activists and help those who cannot come out in open. We are the only ones who can help them. once I come out, I think as Carol put it, there's no person who can stigmatize me. Even if they talk about me, I will not care because I've come in open on my own. No one forced me. But others, I think they still feel, if I say it, the people will run away from me, but that's not it. Life has to continue. Once you are HIV positive or you have TB, it's not the end of the world. Life has to continue. Thank you.
Thank you, Louisa. Did you want to say something else, Yvonne?
Well, I think I want to say, you're better off knowing your status than just walking there and not knowing. We women should be supporting each other. Sometimes we become our worst enemies, women, We're very quick to point fingers. We're very quick to wish away others instead of coming together. I really applaud women like yourselves, guys, who come out in the open and talk about their status. Other people don't even know if they are HIV positive or negative, but they are quick to point fingers. So I really salute you.
Thank you very much, Yvonne. So now I think I'd like to throw it to the people who are here today. For example, why do you think for around TB, why aren't the services improving? Why aren't issues improving the way it was with HIV? Just for people who are here, maybe you've had family who have had TB, just to hear experiences from people, but also to find out why the steps in TB are much smaller than it was in HIV. How can we move forward? Questions, comments from the audience? I was saying let's share experiences for those who have experiences around TB. What I'm saying is there's more engagement from our HIV colleagues than around TB. So I'm saying what is the reason why you think that is so? And how can we make it better? How can we move forward? Take more strides like the TB constituency has done?
Say that in developing countries, Asia region, the program, how the program they are focusing in terms of HIV and TB. I'm not talking HIV, TB co-infection. TB is separate. HIV is separate. Of course, HIV positive people, when they are getting TB, they are very well referral system, linkage system is happening. But RNTCP, like TB programs, they are not referral the people to come to this HIV. That is one matter. And second thing is like it is not like the fear and the people, those who are in the cultural taboos, they couldn't able to go and share their status to go for testing process. That is one thing. Second thing, their economical condition. It is not possible to afford for a continuous process of investigation, things like that. Even if they are going one time only, they can able to go. But you know about the setups of program interventions, it's for sputum investigation 2 days, first specimen and second specimen, and then coming for X-ray, and for that they cannot able to leave the family and children, and husband might have sick, and coming and sitting for that to access all the investigation, and then result, and then treatment. And that is the second thing. And third thing is the pill burden, and also nutrition, and so many factors are there.
Okay.
Thank you.
Thank you very much. So which is why it's important for us to call for a one-stop shop. You go to one place where you get all the services. Because I actually agree with her. I remember one time when I was in the session in the Global Fund where I was telling people to say, I don't want you people to cut me into little pieces. Where one section of me as a woman living with HIV goes to another department, a section of me as a mother goes to another department, a section of me taking my child goes to another department, a section of me having any other disease. I mean, how long will it take me to go around? I'm one person. I can be one person with 6 diseases, but I need to walk into one door, one health institution, and access all those services. And we have to demand for the services ourselves. If we keep quiet and think somebody else is going to speak on our behalf, nothing is going to improve. Any other comments?
Thank you, and also appreciate you, Yvonne. I'm from South Africa. Appreciate, and just want to also echo what she's saying, to say that sometimes we're talking integration, and it becomes, you wonder what it means. Because for me, I think it's more to do with what is the approach. When you're talking integration, what is the model that is used to talk, to say that it really is working. So I think it's more talking than actual doing. So I think there's more to be explored in terms of making sure that that integration is simplified, especially in terms of the health services, because I think it's more to do with health systems. Things are there, but like you are saying, it's not integrated. It's like being sent from pillar to post, and people are not actually going there. You also are becoming fed up. You cannot just be in the clinic for more than 5 hours. And also, I think at communities, I think there's a lot to be done there. Like in our country, there is a component which they are called healthcare workers. I think those people, if they are actually be involved, they can play a role, because if you refer, or if you go to communities and you have TB and your contacts are not treated, and then what does that mean? Because you've got kids who are at home, you will be taking treatment, but they did not, or someone did not tell you to say that they should come also so that they can be prevented. So I think there's a lot to do within the facilities, to do with health systems, but also a lot of things that need to be done at a community level. Thanks.
Any other comments?
Yeah, thank you, Carol, Louisa, and also Yvonne. I think we have to appreciate that we have come from far, and steps have been made towards integrating TB into HIV programs. I think this is for the first time that we're having a TB HIV networking zone in a HIV conference. I think we need to give a clap to that. Yeah, secondly, to have somebody who has been formally advocating for HIV now doing TB advocacy like Carol or Louisa, I think that's another positive step that we are making. So I think it will take a bit of time for us to get there. And for us to get there, we really need two things. Like she has said, awareness. What does it mean? Unpack that integration. Not just talking about integration. We need to really define, when I'm telling a healthcare worker, for example, to do integration, exactly what does that mean? When I'm telling somebody who does advocacy to integrate, exactly what messages do they need to include in their advocacy processes? And for this to happen, then we need funding, which is funding specifically for TB and HIV integrated services. We appreciate Global Fund for realizing the need for integrating TB and HIV and requesting some countries to do joint TB and HIV concept notes. However, we need more efforts from Global Fund to push the people, the players who are not doing integration, to do that, because we need advocacy from now the higher levels. I think the advocacy at the lower level, we are really doing a lot, but we need some push from Global Fund, from PEPFAR, from UNAIDS. We need a concerted voice that everyone at all levels need to integrate TB and HIV. And with a few years, you're going to get there.
Okay. Thank you.
Am I allowed to speak?
Yes, go ahead, Louis.
Okay. So I'm not sure where the issue lies, and so it's a question to you, Carol. National AIDS programs are within the President's office. The National AIDS Council are controlled because AIDS has a very high-level political opportunity to influence the process. TB is within the Ministry of Health, and a department like malaria, like all the other health services. So even if the Global Fund calls for integrated TB and HIV, you still separate the money. And ultimately, the system is not developed to serve women at the community level. So my question to you is, where is the advocacy targeted? Should it be targeted at the head of state to not have this separation between AIDS and TB, to not have the National AIDS Council sitting in his office while the TB program sits in the Ministry of Health? Is that the way to go? Who is responsible for having these separate systems? Because ultimately, until that changes, women will keep having to walk between whose responsibility, and that needs to change, and that's where the advocacy needs to be targeted.
Okay. Thanks, Louis. I think if I have to talk of my country, where I come from Zambia, I think For us, even if I did do advocacy around the president, he would refer me to the Minister of Health. Because for us, I think they are both under the Ministry of Health, and he would refer me to the Ministry of Health. These are things like, for me, we have tried to do it in my country. We've done advocacy both at national level and community level. What we do is at community level, we create demand so that when the national level people go down to the ground, they find that people are actually demanding for those services. But in most cases, you find that the women themselves don't even have the information. When we even talk about the dual burden, for most of us here, Africans, when I'm a woman, when I'm married, even if I'm sick, I could have TB. Maybe I got it from my husband. Maybe he started getting sick first. Even if I have TB myself, I cannot say, let me sit back and go to the hospital. I have to take care of my husband and my family, even when I'm sick, and my children. Because if I sit in bed and say, okay, I have TB, who's going to cook for me? Who's going to get the firewood? Who's going to get the water? So you have that dual burden of taking care of yourself with a disease and then taking care of your families. You see, so we have the services, but at the same time, we also have our traditional norms that are, for me, I think also need changing. Yeah. Other comments? Okay.
I don't know whether it is Asia or Africa, whatever it may be. I am very happy that Women Networking Zone, you are coming and talking on HIV TB co-infection. We have to see these young women, widows, are living with husband, living with HIV, and how they have to, if they are getting infected HIV plus TB, they have to treat themselves. But we can have to see the factors and economical setup and their poverty and things like that, their role in the family management, and also women, they will be having women perspective, some diseases like sexual, maybe pregnancy or abortion, whatever it may be, and plus TB and plus HIV treatment, ART, and maybe infected child, maybe affected child, they have to take care about the child treatment. Husband might have HIV serious things or whatever. These are all the things where the lady, women can go and access the TV. These things, she has to take care about this menses care, and she has to take care about reproductive care and delivery care, maybe abortion care or family care, and in between ART, immunity and food, and then TB. Sometimes if she is missing something, that is one thing. And so comprehensive approach of the programs. Yeah. In terms of treatment, in terms of care and support, that we need to care for successing that women or whomever it may be.
Thank you. I agree with that. And one thing we should bear in mind is, for us people living with HIV and AIDS, we have a different kind of TB, which is called extrapulmonary TB, which does not show in the lungs. For example, when I had TB, I had to go through more than 4 x-rays. For 6 months, I could not produce sputum. I had a dry cough. And unfortunately for me at that time, I didn't even know I had HIV. So I had this dry cough. I went to the clinics. I went to the hospitals. They could not find the TB. They told me what I had was chronic bronchitis because they could not detect the TB, which makes it even more difficult for us people living with HIV and AIDS, which is why I'm saying we should push and fight. I've had colleagues back home who have had TB in the last 2-3 years, 3, 4, 5 times. They don't even know whether it's drug-resistant TB or it's a relapse, because we don't even have the equipment that will diagnose that. So we have a different kind of TB. I always tell my friends that we people living with HIV and AIDS are special people because we have different diseases. Ordinary people have ordinary TB. We have extrapulmonary TB. Ordinary people have ordinary meningitis. We have cryptococcal meningitis. We have medicines that have fancy names like ritonavir, bocedoponovir, lamivudine, efavirenz, So we have all these special things, with special names. We are living with HIV. We are special people. Well, in a way, I know it's not nice to be proud that you have HIV, but be proud that you're actually here. Like I said, for me, when I started, my CD4 was, I think, at 200. My CD4 is now over 1,000. Yeah. Wow. Because I live openly and productively with HIV, and I refuse for anyone to put me down. I was married for 14 years. I was religiously faithful. I never strayed from my marital bed. I used to sing in the choir, but I have HIV. So that's why I don't allow anyone to point a finger at me and call me names. Yvonne. Oh, sorry. Comment.
Oh, just real briefly. David Bryden with Results in the U.S. I'm so glad I came to this discussion. I've been to discussions like this before, but this one was really, really special for me, just to hear the stories. So what's the answer? To me, one of the things, people that are notable, people that grab the public headlines, the public consciousness, that are well known in the public spotlight, like yourself. I feel like that's such a huge contribution to help raise awareness about these issues. But I also think that people who have been personally affected, like we had, for instance, this Brazilian soccer player, I think is the captain of the team, or unfortunately the Brazilian team didn't do too well in the World Cup, did it? But anyway, but he overcame TB. He went to Russia at one point. He got a terrible case of TB. He managed to be cured. Anyway, and now he's talking about that. So I feel like if we had more people like that, I mean, I know in the States, for instance, in the history of the HIV/AIDS struggle, it mattered when Magic Johnson came forward and said, it mattered, okay? It was, I mean, not to say he's perfect or anything like that, but it's just that helped raise awareness. So, if we could find more people to come forward, whether it was HIV related or not, actually, I still feel that it would be useful if someone came forward and said, I had TB, I'm not ashamed of it. It was a difficult experience, but I'm here to tell you, you can get over it, and we all need to work together to raise awareness. The other thing to me is, we had some good conversations in the faith zone earlier today, and I was really encouraged. The head of Inarella, for instance, the religious leaders who are personally living with HIV, we spoke with her, and she was interested to see how she could bring the TB issue more to light. So that's interesting to me too, because I feel like some of those religious institutions could really be helpful to us to help people understand that TB and TB/HIV are a social justice issue, not just a medical issue. Because I feel like that's been part of the problem, is that TB is perceived as this medical thing, whereas HIV/AIDS, it's a social justice cause, and it's compelling and interesting, and whereas TB, it's that medical thing, don't know, kind of icky. No one wants to, So we got to help people understand. No, TB actually has its social justice aspect to it. Anyway, those are my thoughts.
There's, as we are passing on the mic, actually for HIV you can actually prevent. You either you abstain, you use condoms. TB you can't. I could be sitting next to you with multi-drug resistant TB and you take it. You have it and you. Go ahead, Lydia.
Yeah, thank you. My name is Dr. Lydia Mungera, and I'm also a TB/HIV advocate like Carol. We've worked together. One of the things that we people must remember is that each time we cough, we think we've relapsed. So there's that stigma of thinking that I may have gone back because I had terrible TB and I had in 1997 when I was sick and I had a CD4 count of 1. I told everybody on the stage that day, I had a CD4 count of 1. And I couldn't even get onto the drugs, the ARV drugs, because I was on TB drugs. And I was told you can't take them at the same time. And I was very sick. I was on my deathbed. But the whole thing is that every time you cough, you think you've got TB again. So a number of times we've gone through multiple x-rays thinking we may have got it again. So there's that whole fear. Then I want to also mention a little bit about the TB in children. We really have to advocate for the issues of TB/HIV in children, because we've seen children who are really not thriving, and once you treat them with TB and you see a bad chest, you may not get that positive sputum. It's very difficult to get sputum from a child, but please, we need to also advocate for treatment for children having TB. Then, of course, the last thing I want to talk about is the disseminated form of TB, because if you get fevers of unknown origin, you may think you have malaria, you may think you may have what, but you are likely you can have disseminated TB without knowing. I mean, my late husband died of disseminated TB. And that's when we started saying maybe he had HIV, never tested. But the important thing is that disseminated TB doesn't show like TB. So please, TB shows in many forms. And it's only a liver biopsy which will be able to show you that you have disseminated TB. So we must look for extrapulmonary TB, long-standing backache, and all other things that we can think of can be TB. But please, let's advocate for TB drugs in children, new diagnostics for children, and have the children covered as well. Thank you.
Thank you, Lydia. And one thing we always forget is that TB is curable, people. TB is curable. But I wonder why we're even afraid of even talking about it. Like if you talk about it, you're going to have it. Any other comments?
Hello, good afternoon.
Good
I'm
afternoon.
Anne from Seychelles. So I'm from the SADC region. I do understand what is going on. I was trained in the University of Zimbabwe. And as a medical student, we are told we are all living with TB because we are so much exposed. There were so many patients around. It's just a matter of when our immunity will go down and we will develop it. So we learn to live with TB from a very young age. So we're not really afraid of it. And if one of us got TB, we knew that that person had been exposed somehow, sometime. But I work in the Seychelles. We have very few cases of TB per year, about 20, 25, and most of them are not HIV positive. But the beauty of it is that everybody is treated at one center, as we're talking about. So whether you have HIV or TB or PMTCT, we are all treated in the same center. The only problem is after a while, the center becomes stigmatized because people know when you are going to the communicable diseases unit, you either have HIV or TB, or you have malaria, or you have leprosy. And it's very difficult to choose which one you're going to have. So this is what our experience. It's good to have these centers which caters for everyone, for all the diseases in one person. But the danger also, which we have to educate people about, is the stigma. And this is our experience with having a one-stop shop. But it is a wonderful thing. I think for the patient, as you said, you cannot have one segment of the patient treated in a different place. But thank you for all of you who've been sharing so openly. I'm also part of the region.
Okay. Thank you. Thank you very much. I think, like you rightly said, it's really around information, not having information. A person with TB, when you're in treatment for 2 weeks, right? You are no longer infectious, and people don't have that kind of information. And I think that's what the problem is. Even back home, when you talk about having the one-stop shop, people worry about that. That you might have, the nosocomial infection, you might get a TB in the course of you going to access treatment. So for me, I think the main thing is information. When you look at my country, Zambia, we have so much information around HIV everywhere. But for TB, there's very minimal information. In my country right now, it's only our organization, which is a small community-based organization that really has posters and IEC materials around TB. So there's very little that's being done around TB. But again, calling out to all those activists that are out there, it's important for us to really push for TB. But my core in this conference is people living with HIV and AIDS. Please, let's come on board. TB is killing us. Keeping quiet. We normally only talk about it when we have it. For example, I started off as an HIV activist. I'm a TB activist because I had TB. So let's go out there and start working around this, advocating around this before we have TB ourselves, before our families, before our loved ones have TB. So at the conferences, when I come to conferences, that is my core. And I'm grateful for the support of people like Yvonne, who are always coming to help us have our voices heard. I'm sure if I was sitting here alone, there'd be 2 people. But with Yvonne here, I can help people. And, I've worked with her for many years. She's helped support and move our work forward. So maybe before we close, I can pass on for closing remarks from Yvonne and then Louisa. Yvonne.
Thank you, Carol and Louisa. It's actually nice that we've got a couple of doctors here, talking to us and trained, and our beloved sister here who says my CD count was 1. So really, I think 20 years ago, HIV, we all thought it was a death sentence. But really, we've moved forward now. There's treatment, ARVs are available, all the resources that we need are there. But I think we still need to teach our young people as well. Women should be taught, young people more especially should be taught. And I'm so grateful to people like yourselves who really know their status, and my support will always be there. I love singing, but I love being with you too.
Thank you. Louisa.
Thank you, Carol. I think my comment would be, I'm attending this conference for the first time, but when we had a march yesterday, I think I could see that most of these placards, the posters that they had, we didn't have a lot of TB messages. Most of the posters concentrated on HIV. But I think it would be nice that each time we have these conferences, as TB activists, let's come up with proper messages so that it can be sent out to all the people around. I think we are too silent on TB. But being a TB survivor, I think it would be nice that we bring out these messages loud and clear to all the people around. Thank you.
I think in closing, I'd like to comment that for adding on to what Louisa said, somebody told me to say, because we have a TB conference every year, and this year it's in Barcelona. And somebody told me to say, are you going to have HIV sessions at the TB conference? So I think we'll ensure that we have a lot of HIV sessions at the Barcelona conference. I think before we close off, maybe Victoria, you want to say something? Okay, you don't want to say? Okay, I wanted Victoria to say something because she trained me to be able to speak and really be free with myself. So I wanted her, she's my mentor. I wanted her to say something. Did you want to?
David, want to say something? We've got a well-organized man here, a woman.
Oh, thank you. So just a brief commercial, which is that the TB HIV networking zone is right around the corner with amazing programs, presentations on all kinds of topics that you don't want to miss.
Okay, Evelyn wants to say something?
Yeah, thank you, Carol. I just want to respond to her issue of unpacking the integration thing and say the AIDS Alliance has developed a very nice manual that guides civil society on how to integrate TB into their HIV programs. And they're launching it today at the HIV networking zone, HIV TB networking zone at 4. So if you're there, you'll get a copy and also you'll understand exactly what steps do you take to integrate TB and HIV. Thank you.
Okay. And last but not least, for women from Africa here who want to sort of join groups, we have what we call the Pan-African Positive Women's Coalition, which will be doing a lot of work around TB. I'm the current chairperson. I was elected last week. Yay! So if you want to get more about that, please see me after the session. I'd like to thank you all for coming. Thanks.
Well done, Louisa.
She's working.